Did you know that sticky film on your teeth can turn into very hard tartar deposits on the teeth that only a dental professional can remove? My name is Dr. Mo, and I'm a dentist. In this video, we're going inside the mouth and we're gonna dive deep into this topic. So that this video would go to more people, push a like, and let's start. Let's start with dental plaque. Dental plaque is this soft material that contains bacteria and other problematic components that forms on the teeth and along the gum line especially. And the problem with this dental plaque is that it contributes to gum disease. And if gum disease is left untreated, it can progress into something called as periodontal disease. And periodontal disease is quite dangerous because people can actually literally lose their teeth from periodontal disease. But I'm not going to go there right now. I'm just progressing slowly talking about this dental plaque. So this dental plaque is also like a biofilm that contains bacteria and other components, like we said, and it can start as even somewhat invisible. So it starts very quickly and naturally forms every day on the teeth. Problem with it, it accumulates and it builds further over time. This dental plaque has a tendency to form in the lingual or like the inside surfaces of especially the lower teeth, and has tendency to also form in the buccal surfaces, okay, meaning the surfaces of the upper molars that are facing the cheeks, okay. There are a lot of reasons for this. There are salivary ducts that opens there. Saliva is good for you in general, but it also contains the calcium, which is good for teeth, but it also contributes to the dental calculus formation. I'm not going to dive deep into that topic too. Just I'm telling you where this dental plaque has a tendency to accumulate. And if someone has poor oral hygiene, that dental plaque can also rapidly accumulate along many other surfaces in the mouth, on the teeth, along the gum lines, and so forth. And this dental plaque, if it's not cleaned in a timely manner using toothbrushes and a dental floss, it can slowly turn into dental calculus. Dental calculus, as we said, is much stickier and it's much more problematic to deal with and will require a dental professional like a dentist, dental hygienist, or even a periodontist, which is a specialist, to deal with it. Okay? There are people who literally go to school, right, to become, for example, dental hygienists to deal with these specific problems. Now, of course, they have a quite wider scope and they deal with other things, but this is one of the most important things that they actually deal with, that and gum health and other problems. One thing we need to address is this plaque to calculus transition. So the dental plaque fully mineralizes into dental calculus. Some of you may have heard of this as dental tartar. Dental tartar is firmly attached and cannot be removed by brushing alone. As I said, dental tartar is quite more problematic when it comes to removal in comparison with dental plaque. I'll just add a very important note is that dental plaque itself, actually based on scientific evidence, really also contributes to gum disease. So keep that in mind. So just because dental plaque can be somewhat easier to remove relative to dental tartar does not mean that it's not problematic. It is problematic and it does, based on scientific evidence, contribute to gum disease. Okay? I have a lot of videos on gum disease. You can check them out later. So the appearance is yellow to yellow brown in color. I'll put some visuals so you can have a look also. So if you pay attention to the lingual surfaces or the inside surfaces, for example, of the lower teeth, as I said, you're going to see tartar often does have a tendency to accumulate their dental plaque, and dental tartar. Okay, so the annoying thing with dental plaque and dental tartar is that it can also form on the surfaces of the wisdom teeth. And these are regions where some people, even the ones who really try to take care of their oral health, may be either not necessarily intentionally ignoring, but they may be somewhat of areas that are difficult to reach with a toothbrush. So what does that mean? It means that it's very important to clean these areas and floss these areas as well. The wisdom teeth region areas. Of course, if someone can do that, there are different orientations that the wisdom tooth may come in, but I'm saying if it's possible in general. So a lot of people, I do some live streams. A lot of people ask me, well, what are the like things that we need to take into consideration on a regular and daily basis, like daily habits that we can build to minimize and to lower the risk of these problems from happening. And as I say, it's actually relatively simple, and this may sound cliche to you, but proper brushing and proper flossing, also cleaning the tongue very well. A lot of people they clean the teeth and the gums, but they kind of somewhat ignore the tongue, which I don't get it honestly. But it's very important to clean the tongue too. Okay, so what about prevention tips? I kind of discussed some of this already, but generally speaking, brushing twice a day, including the lingual surfaces. Lingual means towards the tongue, buccal means toward the cheek. These are just a dental terminology. Don't get too concerned with it. So flossing, as I said, to remove the dental plaque between the teeth. Someone may try to argue with me on the live stream, and he said, "Well, why isn't brushing only enough?" Well, because due to the design of the toothbrush and its brushing surface, it's very difficult for it to access the small areas in between the teeth. And that's where the role of a dental floss is very important. It's to reach these teeth in order to clean them properly. Of course, don't forget the regular checkups with the dentist to make sure everything is okay, as well as a dental hygienist. If you have access to one, it's probably a good idea to have a checkup and see what's going on, if everything's okay, if someone needs a cleaning, regular checkups with the dentist and even the dental hygienist to check the overall dental and gum health. Okay. As I said, dealing with dental plaque early contributes to the prevention of dental tartar formation and minimizing dental tartar formation. I talk a lot about dental tartar formation because it's very problematic, and if all of this is left untreated, it will contribute to gum disease, gingivitis. Gingivitis is left untreated. We progress to something even worse, and that is periodontal disease and periodontitis. Periodontitis, now we're talking about involving the bone that is supporting the teeth. And if that bone starts to get involved and the periodontitis progresses and the person loses this bone support, then the teeth will become mobile. And not only they will become mobile, that person may start to lose some, if not all, of their teeth due to periodontitis. You can research later periodontitis and tooth loss. Okay, so there you have it, a peek inside the mouth showing you how plaque becomes dental tartar. Remember, prevention is easier than treatment, especially in this context. So keep brushing, flossing, and visit your dentist regularly. Your teeth will thank you, that is for sure. As always, Dr. Mo Dentist out. Like, subscribe, and share this with your friends. Peace.